Hallelujah. 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 Oh, hallelujah. 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 Hallelujah.
I have all these blinking Zooms. Raisha, Miranda. How's everybody doing today for a Monday?
Okay.
Pardon me?
Okay.
Okay. Did y'all have a nice weekend?
I work this weekend.
Work this weekend, okay?
Professor Marvel.
Yes. Hi, Omar.
Hi.
Yes. Hey.
Listen, could you give me about 5 or 10 minutes? I just got off work. I'm about 5-10 minutes away from my house.
Sure, but you're gonna have to log off and log back on if you're driving.
Absolutely.
Okay.
Absolutely. You know that already. I'm just saying, like, literally, I'll be home and I'll log back in.
Okay. Sounds good, Omar.
Okay.
Thank
See
you.
you then.
Yep.
See you soon. All right. Bye-bye.
Bye.
Can I see?
Alishka, your green screen.
No. You had a cup. Put that back. Ella, put it back.
If everybody could put their name and their campus in the chat, I would appreciate it. Thank you. Raisha, any idea why your Zoom's not working? Same with Alishka. Any idea why your Zoom's not working?
I don't know, mine be like that every week when I log in. I'm not sure why.
Have you called Zoom? It was happening to me as far as sharing screens earlier, and I called Zoom, and there was a upgrade. And so they took me into settings and
Yeah.
showed me how to do the upgrade, and I did the upgrade. And so
Miss
far,
Marvel, I don't know what's going on with my camera, but I think it's every time that I log in with my computer. So if it continues, I'll just log in with my phone if that's okay with you.
that would be great.
Okay, I'll be right back then.
Yeah.
Let me log in with my phone.
Yep.
When we was in with Miss Dr. Brown, she was saying that it was something about with the update that Zoom had did that would cause the video to like freeze like that. So she said they notified Zoom about the issues and they're supposed to be working on it.
Yeah. But you go into go into your Zoom settings if you can and see if there's an update. That's what the issue with, I don't know if it's the same thing, but that was the issue with me is there was an update in there that I wasn't alerted to. And I had signed up for any kind of updates through Zoom if they had upgrades, and I wasn't alerted, but once they walked me through it, I did it. Everything was great. So I don't know if you need to try that. I don't know. Okay, well, let's get started. And you guys, if you're, let's see. Yeah, a lot of people are having Zoom issues today.
Yeah, mine's doing it too.
Who said that?
Michael.
Yours looks fine on this end.
I stopped the video, then I redid it, and then it stopped for a
Oh,
second.
okay.
Can you see me now, Miss Marvel?
Yes, thank
Okay,
you. Thank you,
great.
thank you. Okay,
I think it's the computer. I got a loaner computer from the school,
okay.
and I did a test earlier today. And you know how on ExamSoft you have to like take a picture of yourself?
Mhm.
It wasn't even working.
Oh,
So I
Hmm.
don't know.
okay,
I'm about to go tomorrow to the campus and have IT check it out because
Okay.
it's not the first time that I've happened. So
all right. Okay. Okay, well, we'll go with what we have now, and if, I don't know if some of you guys are working on your Zoom issue, but we'll go with what we have. So welcome to week 9. Hard to believe that we're just a couple of weeks away. I want to go over a couple of announcements I sent out in the last couple of days. So I want to go over some announcements, a module, and then cover some content from today. And then we're going to do our group presentations from the infectious disease. And I think I told you that last week. We kind of ran out of time with the quiz 5 and the content. And we were covering 2 weeks worth of material. So we'll do that today. Does anybody have any questions before we get started? Make sure you put your names and your campuses in the chat. Okay.
I got a question about
Oh.
the HESI because it wasn't listed like for Cincinnati when like if we were gonna take it in campus or not.
Cincinnati's on campus. I know that. They just haven't provided the dates yet.
Okay, great. That was
So
gonna be my main thing.
Yep. So you need to reach out to your campuses.
Okay.
And what I provided was simply dates and times, like I said in the
Okay.
announcement. That's what we're getting. So it's up to you to get with your campus if your dates have been selected and sign up for your HESI.
Okay.
Okay, I'm simply trying to give you a heads up on dates and times and know that it's ready to be signed up for.
Okie dokie.
Okay, so yeah, there were a couple of campuses that didn't have their dates yet, Cincinnati being one of them. So check with your campus. So let's go through a couple of scheduling your HESI. So here's one of them, which is what you were just asking about. So again, your HESI's in 2 weeks, right? Beginning with your HESI is, and there's a lot of campuses I saw that have their HESI scheduled for Monday. So 2 weeks from today. So believe it or not, you have an exam next week on Monday, and then you jump right into the HESI. So here's your announcement. Please click on this right here, and it gives the well, I'll click on it for you. And it gives the schedule for all, in case you haven't looked yet. It gives the schedule that we have so far. Okay. So there's the only thing I do know is Pensacola is going to be Proctor U this term. So if anybody's from Pensacola, I believe you are scheduled to attend a Proctor U training. So hopefully you have done that. Okay, so that was one announcement I want to make sure you're aware of, that you can sign up for HESIs now. And I don't need to know when you signed up. What I need to know is if you're having problems signing up, so I can help facilitate that. I also want to share with you that
Miss Marble, sorry. So I just saw it and it says community is gonna be on 3/24 from 12:30 to 6:30.
3/24, this is Cincinnati.
Yes,
Okay, so 3/24 from 12:30 to 6:30. Okay, good.
yes,
So that
this is on Evolve.
okay, so that's new information. So anybody who's from the Cincinnati campus, let's see. Let's see, who do we have? Whoever's from the Cincinnati campus, that's the new dates. I'll put that in an announcement. Thank you, Alishka. I appreciate it. I also sent you the study guide over the weekend. Please take note of the study guide. Okay, as I've told you before, the study guide is a good starting point for getting prepped for your exam 3. We have reviews coming up next week, or is it this week? This week. They are today, tomorrow, and Wednesday. Okay, so please take note of that. Tonight at 8 p.m. Eastern, tomorrow, or excuse me, Tuesday. Monday, I'm sorry, tonight is Professor Ford, tomorrow is Professor Kershaw, and Wednesday is me. Okay, so
Marble,
pardon me?
the Zoom link for Professor Ford, I never able to get to that Zoom link you gave. I don't think it's the right Zoom link.
Really? Okay, let me check on that. All right, I'll check on that. Scheduling your HESI roadmap. So that's what I want to go over. Did anybody have any, have you guys taken a look at this? This goes through weeks 9 through 12. Okay. Did anybody have any questions on this?
What is this?
This is your week. This is an announcement I sent last night. It's your weekly roadmap for the rest of the term.
Okay.
Okay, it's weeks 9 through 12. And it goes through each week. What's going to be happening. So if you haven't taken a look at it, please do. This is your roadmap. This is your announcement for the next 3 weeks. This is the last week of content. Right? So next week you have exam 3. The following week you have your HESI and your remediation. And it gives, Marlene, it gives all the due dates. Okay, so if you haven't had a chance to look at this, this is an important announcement.
Wait, can I ask a question?
Yeah,
What day are we taking exam 3?
on
The
the same
date.
day as your class, today, a week from today.
It doesn't seem to match up with.
Your
Oh,
exam is,
okay. I was reading something wrong. My bad. That's
okay,
me.
yep. You'll be taking exam 3 a week from today.
On the,
Thank you.
on your announcement, it doesn't let you load that week 9 notes.
Yeah, I need to reload it for you.
Okay.
Reload week. I'm able to open it. I did receive an email from a student about that. I'm able to open it. I don't know why you guys aren't, so I will resave that and put it out in the announcement, your week 9 notes. Thank you. Anything else? So next week, just remember, I'll send out some HESI reviews as well. Not only do you have an exam, but we're going to offer 3 HESI review sessions. Okay, kind of like exam 1, exam 2, exam 3, we'll be doing a HESI review. So once we get our schedule together, I'll put out when those 3 HESI reviews are going to be. And I encourage you, I've already taken a look at several HESI reviews that have been submitted. That's your study guide. Okay, there's a few students that are using the original HESI study guide that was in the week 1 module. Let me go back and show you. Can't do anything about it now, but where was it? Week 1.
Hi, Professor.
Yeah.
Are you able to see me? Because I'm having a bad connection.
I can see you.
with
I can see you. Yeah. Hang on. I just want to make sure you guys are, 1 second. Let me go through. I want to show you an announcement from early on. Right here. So I sent you guys in week 1 the updated HESI study guide. Okay. The original. Let's see if hang on. Anyway, so I sent you in week 1 the updated HESI prep assignment. Some of you are still using the original one, so just please be mindful of that. I mean, I've graded what's submitted, but I think at least 3 students were using the original one, which was the old one. This was the updated one, and I know I mentioned it in class. You know if it's the updated one if you have the directions. Okay, and most of you are using this one. Okay, but for the few students that aren't, just be mindful. I would go back and look and see what else needs to be covered. I didn't mark off any points to anybody using the original one, but you need to look at the updated one to see what information you're missing with regards to studying. Okay, does that make sense? Does that make sense, you guys? Okay, let's go through some content. I have our week 9 notes, and then I want to pull up the book. I think we'll start with the book first. I wanted to start with chapter 45, which was in your med surge, and it was care of patients with emerging conditions, trauma, and shock. And we need to cover pages 1048 to 1054. Whoops, maybe I didn't share my screen here. Hang on. I didn't. So hang on. Did everybody see that?
Yes, ma'am.
All right, so let's go through a couple of things we need to know from this chapter. Remember, you only have certain pages, 1048 to 1054. And the section is prevention of accidents. Okay, this is page 1047. Okay, where it talks about home safety, highway safety, and water safety. Okay, so I do need you to have a look at these sections, okay? We don't need to read the whole chapter. Okay, we just need to look at a few sections of it. So what are some tips for home safety? And they really break it down to kitchens, storage areas, living room, furnace, bathroom, bedroom, stairways, and general areas. So please have a look at that. And then there's a short section on highway safety, emphasis on seat belts, enforcing better laws against impaired driving. And then there's some information on water safety. So if you haven't looked at this yet in preparation for class, I'm just showing you where this is, but you do need to read this. Okay, and it goes through a scenario of a victim of a diving injury. Should not be removed from the water until EMS comes because of possible neck and spinal cord injury.
It's
Right,
funny,
yeah.
I just had my med search test and it was a question about that. What should
Really?
you do in a near drowning scenario of a patient? And one of the options was stabilize the neck and not move the patient.
Yep, yep. But what if you're what if the only reason you would remove the person from the water is if they weren't breathing and you couldn't perform your rescue breathing in the water? You'd have to take the individual from the water and start rescue breathing. Okay. So review the home, highway, and safety. Okay. And then the other section you need to review is domestic and intimate partner violence. And we'll talk about that when we get to week 9 notes as well. There was a nice summary of week 9 notes, in your week 9 notes, of domestic and intimate partner violence. Okay. Box 45.3, if you're doing the assessment and you're doing the interviewing of a client, here's 5 questions, 5 key questions that you should be asking. Because as I've talked about, when we've talked about abuse and violence, it doesn't matter what type of nursing environment you're working in, you're always going to be exposed to potential perpetrators, potential victims, whether they be elderly, adults, children. And so you need to be able to identify and assess risk and assess signs and symptoms of abuse and violence. Okay, there's a section on child abuse, elder abuse, and then how do we provide emergency care in the community setting? Triage. When we're triaging, what is triaging? What's triage? What's
Prioritizing
patients.
essentially.
prioritizing? Right? And there is a sequence of assessment. It's ABCDE. I don't know if you've learned this yet. Airway, breathing, circulation. D, we know ABCs, but D is the assessment of neurologic disability. And then E is exposure. We need to try and expose all areas of the body so that injuries are not missed underneath clothing. Okay, and then it goes through and gives a little bit more of some more detail about the ABCDE. Okay. Control of bleeding. These are for go ahead.
Professor Marvel, quick question. I'm just on the fence with this. We're sticking with strictly ABCDE because some places like to go CAB. So I'm not sure. Like it's
For purposes of this chapter, Omar, we're going to cover the ABCDE. So,
Okay.
But I know there are other ways to look at it, and other professions look at this in different ways, but for purposes of this class, we're looking at it with the ABCDE.
Okay.
Okay?
Okay.
And then also other factors that you might face is having to try and control bleeding. Potentially leading to shock. Okay, I don't know if you've all had the training with your CPR, with the Stop the Bleed training. Has anybody had that? Stop the Bleed training. What do we do with spine and neck injuries?
Stabilize it is one of the main focuses.
Okay.
They're under C-spine precautions.
Yep. Chest trauma. Actually, you know what? This is beyond our page, so pages. So after control of bleeding, that's it. So I want you, that's the pages I want you to review. Okay, beyond that, do not go beyond that. Do not go beyond page 1053. Okay? You only had a few pages to review for legal and ethical aspects of nursing, page 35 and 41. So let's cover what that is. I'd like for you to be familiar with box 3.2 on page 35. It's patient care partnership. What patients can expect from us during their hospital stay. And I'd like for you to have a look at that. They expect high quality hospital care, clean and safe environment, involvement in their care, helping them understand their medical condition, discussing treatment plans, getting information. They want information from us. They want to review their health plan and their goals. They want their privacy protected. Okay? So please have a look at that. What patients expect. And then I want to jump down to HIPAA. Okay, so you don't need to read everything in between, just the highlighted areas I'm doing with you. What the patient expects of us in the hospital, and then HIPAA, which is patient rights, 6 patient rights and responsibilities. Consent, notice, access, amendment, accounting for disclosure, and restriction of disclosure. I simply would like you to know what the 6 patient rights are. So this is an excellent summary of what those patient rights are. Then the last part of this chapter that you need to understand is negligence and malpractice. What's the difference between negligence and malpractice?
Negligence is something that you are supposed to do and you don't do it. You don't do it just because you don't want to, or in malpractice is something that happens in the process of doing something.
So
Like a
malpractice, go ahead.
No, I was gonna say like a mid-error.
So negligence is basically us failing to meet the standard of care. What would any reasonable person do in the same situation? Failing to meet the standard of care. Failing to do something that is reasonable and prudent that a person would do. Okay? Malpractice is negligence by a professional person. So an example of nursing malpractice would be that if the nurse did not check the patient's vital signs in condition after surgery. There was a hemorrhage, patient went into shock and died. So to prove malpractice, 4 elements need to be present. Okay. We're going to go to box 3.6 because here it is summarized. So you need to be aware of box 3.6. So first we have a duty. So our obligation to provide due care, provide care within the scope of our practice. Second, there needs to be a breach of the duty, that we fail to perform our scope of practice. Okay, so example, nurse fails to check vital signs after surgery. Or the nurse begins CPR on a patient who had a DNR order. That's the breach of duty. Causation. The nurse's action or actually inaction cause harm to the patient. So there must be a link between breach of duty and injury. So for example, the nurse's failure to check the patient's condition led to an undetected loss of blood and caused death. So what was the cause of the breach? And then the last element of malpractice is the actual harm or injury from the negligence. And we know that injury can be physical, emotional, or financial. Right? Maybe pain and suffering, loss of ability to continue work, physical and emotional disabilities, extended hospitalization, or death are all considered injury or damage in a negligent action. So what I want you to know is what the 4 elements, that 4 bars that need to be met for malpractice. Okay? And then the other chapter we had some content in was chapter 14, which is culture. And this is also in our week 9 notes. So I'm just going to simply review what's in the book. We needed 187 to 189, which is the beginning of the chapter. What is culture? What is culture? What's a culture? We're going to be working with lots of diverse cultures over the course of our nursing career. Culture is a set of values, beliefs, and assumptions about life that is shared and maintained by a group of people. Right? We know that culture encompasses a variety of learned behaviors, beliefs, attitudes, and norms. Culture is learned and acquired. Culture is shared by a group. Culture is incorporated into our identities. And culture is dynamic and changes under the influences of shared experience. Understanding spirituality. We talked about this early on. Do you guys remember what's the difference between spirituality and religiosity, or spiritual and religion? What's the difference?
Spirituality deals with like the person's attitude towards a higher being, and religion, it's like a ritual, something like a ritual, like a denomination that you belong to.
Exactly. That's exactly right. Did everybody hear that? That's exactly right. Spirituality is your views of the higher power. Okay, religiosity is belonging to a congregation and practicing a single religion. And then there's a few major religions that you need to be able to recognize. And I just need you to know what they are. You know, one is Christianity. One is Judaism. And one was, we missed one. Islam. So those are the three religions I'd like for you to be aware of. Okay? And then I want to skip to page 193. So again, I'm just covering what you're reading.
Judaism, Islam, and what else?
Pardon me?
The religion.
Christianity, Islam, and Judaism.
Okay.
The three of them. The other section that I want you to review is barriers. This is your second part of the reading of page 193 to 200. And this is all about culture. Okay, specifically, we'll start with barriers. Well, actually, it starts right here. Developing cultural competence, page 194. We've talked about this the whole term. Cultural competence involves knowing yourself, examining your own values, attitudes, beliefs. We have to try and keep an open mind and try and see the world from different cultural perspectives. What are some barriers to cultural competence? Well, we have stereotyping, prejudice, ethnocentrism, imposition, conflict, and shock. So beware of those terms when it comes to barriers. We certainly know there's a lot of cultural differences. Okay? They can come across in different cultures' view of communication, view of time, personal space, family, social organization and structure, nutritional practices, issues related to death and dying, and healthcare beliefs, right? Every culture sees all of these different factors differently. If we don't know, what do?
I'll ask questions.
We ask. And the rest of this section goes through all these different factors, starting with up here, starting with communication. Okay, it goes through communication, view of time, personal space, structure, nutrition, death and dying, and healthcare beliefs. So this little paragraph here, this beginning of cultural differences, you need to know what the different factors are. 1, 2, 3, 4, 5, 6, 8. There's 8 cultural differences. What are they? Okay. And then the last section I'd like for you to read through is the nursing process and clinical judgment model in transcultural nursing. This is next gen. Okay, clinical judgment or nursing process and clinical judgment. And it takes you through the ADPI with regards to transcultural nursing. Takes you through the assessment, data analysis, planning, implementation, and evaluation. Okay, so if you haven't read that yet, this is all part of your reading for this week. Okay. We want to bring up our week 9 notes and make sure we covered. So your week 9 notes have 2 sections, cultural influences and abuse. So let's go through that. So we've talked about culture is everything we believe to be true about the world. right? Beliefs, values, assumptions about life that we pick up through going through lives, through socialization in childhood. Right? Different ethnic groups may have cultural similarities, but we're all unique because we grew up differently, right? So culture, extending the conversation of culture encompasses a wide range of behaviors, language, touch, personal space, body language, perceptions of health and illness. We just talked about that. That's in your chapter. It influences family structure, childbearing practices, time orientation, eye contact. Just talked about that. Nurses must approach each patient as completely unique. And we learn through observation and assessment. And as we've talked about before, we have to understand our own cultural beliefs so that we're not passing on judgment and stereotyping. We have to try and maintain an open and objective attitude towards individuals and their cultures. Avoid seeing individuals alike. Be aware of our own beliefs. Right? Some of us may not have the cultural knowledge or the cultural confidence to be able to take care of different kinds of cultures. We may feel like we're not prepared. And to develop cultural competence, you have to be sensitive to cultural implications. I'm just going through your week 9 notes. Avoid stereotyping. Avoid making assumptions about nonverbal cues from clients or from clients that have unfamiliar cultures. Okay. So cultural competence and the development of cultural competence is a really important part of our nursing profession. It's going to happen wherever you work. It doesn't matter the environment you work in. Cultural competence is key. Okay. Let's talk about violence here for a bit. We know that violence is very common in vulnerable populations. Right? Just as substance abuse is as a means of exhibiting or regaining control. It's predictable and thus preventable if we look at both the victims and the perpetrators. High levels of violence are tied to health disparities and adverse health outcomes. Chronic stress, physiological conditions, obesity, diabetes, hypertension, cancer. Remember, we are mandatory reporters of violence against children and elders and vulnerable adults. What does that mean? What does mandatory reporting mean?
We have to report it.
Where? Just in our workplace?
No, anywhere.
What if you were at the grocery store? And you see something going on, are you obligated to report it? That's a yes or no question, guys.
Yes.
Ethically, yes.
Anywhere
Ethically, yes.
What?
Ethically, yes, you would.
Well, you're mandated. So, ethically, yes, but you are required to report any observations or suggestions of neglect or abuse in any setting you're in. What about a family barbecue or a neighborhood barbecue? You suspect something, do you report it? The answer is yes. We do not have to report violence. We don't need anybody's permission. Okay? We're obligated to report. Children who are exposed to violence, victims or witnesses are at high risk for mental disorders, self-harm, substance abuse, and completed suicide. Okay. Abuse is about power and control. Generally, family violence is violence of the most powerful against the least powerful. Family violence is usually perpetuated in a cycle as children grow up seeing violence used as a method to control the kids and the mother. Would you guys agree with that? Abused kids are more likely to perpetuate violence or tolerate violence in their own relationships as adults. Families living in poverty or dealing with a crisis are more likely to experience violence. Social isolation contributes to violence, especially with a reduced social support system and their inability to cope with violence or cope with crises. And then elder abuse is a type of family violence. We're required to report any suspicions of elder abuse, just like we are child abuse. So victims of violence usually exhibit symptoms. Children are prone to headaches, stomach aches, bedwetting, anxiety, depression, withdrawal, maybe having inappropriate sexual behavior or knowledge. Okay. Abused women are prone to chronic headaches, palpitations, sleep, appetite disturbances, sexual dysfunction, IBS, UTIs, and they may even exhibit more miscarriages, preterm birth, or low birth weight infants. And we do know that abuse generally escalates in pregnancy. We know that elders are at risk for neglect and abuse, physical, emotional, financial abuse. What does emotional abuse look like with the elderly? Maybe behaviors that demean them, affect their self-esteem, maybe name calling, embarrassing them, destroying property, not letting them see family and friends. And then neglect is when their basic needs are not being met. Food, housing, clothing, medical care, abandonment of the client. And then another kind of abuse is suicide. Suicide, self-directed violence, is the second leading cause of death in adults, young adults, 10 to 34. So some risk factors of suicide are depression, unintended pregnancy, STDs, especially HIV, intimate partner violence, substance abuse, and maybe prior suicide attempts. So what can we do? We talk about primary, secondary, and tertiary interventions. Well, with regards to abuse, maybe we as nurses in the community can adopt some primary prevention strategies, maybe school-based education programs on coping, teaching parents, helping them understand good coping skills, anger management, maybe home visitation programs for families that are at high risk for violence. What would be some secondary interventions that we could do?
Screen for violence.
Screen for violence. Maybe screening through surveys or behavioral surveys with kids, parents. Assessment of school clinic visits for kids. Kids like to talk. Kids will talk about what's going on in their home. And then what do you do if if you're working with a victim of abuse, any kind of abuse? What are some tertiary interventions? They've already had this happen to them. Now what?
Support system, maybe a way, not a way out, but like maybe a home.
Ask therapeutic questions.
Well, you want to find them resources, right? Something's already happened to them. Now you have to help them. Tertiary is about managing, controlling, trying to stop the bleeding, if you will. So we're looking for resources. Maybe it's a domestic violence shelter for women. Maybe it's removing kids from the home and temporarily putting them in foster care. Tertiary is about action. What can we do to keep these victims safe? What resources do we have?
There are different safe houses.
Safe houses. Yep. Okay. So that's a little bit, that's the content I wanted to cover today. Does anybody have any questions? So please go back to the few chapters that I pulled out the pages that you're responsible for and review just the pages you're responsible for. If you haven't done it as preparation for class, you're going to have to go back and redo it. Your notes are a summary of the big topics from this week, which is cultural competence and violence and abuse. Okay. Questions? And you'll see both of these topics covered on your study guide. Okay. Questions? Okay, let's spend the next half hour doing some group projects, presentations. I'm just going to go in order. We have our alpha group. I think everybody's here. Brianna, you're here. Cedrica, you're here. Is Yushika here? No. Oh yeah, there you are. And Stephanie. Yep, you four are here. So you guys did hepatitis.
Yes.
Stephanie, can you turn your camera on? So tell us about your project. Somebody can start from the group.
Brianna, are you ready? Brianna was supposed to do like a PowerPoint for the group representing the group, but I don't know if she's ready.
Hey,
But
Brianna, can you hear us?
anyways,
Brianna?
I'll just go ahead and do a little overview.
Okay.
So hepatitis is an inflammation of the liver. It can be caused by a virus, a bacteria, or hepatotoxic drugs. So we have different types of hepatitis, A through E, and they're transmitted through different routes. So hepatitis A is transmitted through food and water. So those patients who have hepatitis A, they shouldn't be preparing their own food. Should get somebody else to prepare their own food and make sure that the water that they're ingested is not contaminated. Hepatitis B is through bodily fluid, through sex or childbirth, through labor. The baby can even get it by childbirth. Hepatitis C is mainly transmitted through IV drug users using unsterile needles and sharing needles. And E is the same as A. It's waterborne and transmitted through food. Some signs and symptoms of hepatitis, all the hepatitis would be jaundice, dark colored urine, clay colored urine because of fat indigestion, vomiting, flu-like symptoms such as they're feeling fatigue all the time, have a high fever, decreased appetite, abdominal pain. Some nursing interventions would be encouraging rest. They have to change their diet. So decrease protein and fat, and because the liver can't break it down, the liver is sick. Increase calories, carbohydrates, because they're fatigued, they need that calorie for energy, and small frequent meals. Proper hand hygiene also. And if they have an active form of hepatitis, they should avoid like sexual intercourse until the antibodies are negative. So that's all that I have. And it's also under surveillance by the CDC. It's one of those diseases that are reportable. So that's
Okay.
pretty much the overview.
Okay. And so who else do we have? Stephanie, there you are. What are some ways to maybe try and control the transmission of hepatitis?
Like Cedrica had mentioned before, for the patients that have like the A's, they should not be doing their own food, which means if they're cooking, then whoever at the house can be eating the food too. So that's mean they can pass it on. So they should not be cooking or touching anything.
Yep.
And for the B's, you should have no sexual intercourse. So you should like try stay away from that and anything like that to prevent that. And also be mindful of like your surrounding, so you don't like pass it on.
Okay, excellent. Yashika, where are you? There you are. Common treatment approaches. Yashika, you're on mute.
Oh, sorry.
What are some common treatment approaches?
Treatment. Let me flip through my paperwork. Sorry. Let me look at my computer because I'm on my phone using Zoom. So let me pull it up on my computer.
Okay.
So then I won't be trying to squint my eyes.
Did you guys learn a lot by doing this project?
Yes.
Did you learn things that you didn't know?
Yeah.
Cedrica,
Somewhat.
Stephanie?
Yes.
Someone, most of those we had learned from like our med search class, but some like extra informations that we figure out while we're doing it.
And did we decide that hepatitis is a reportable disease?
Yes.
Yes.
Each one?
I think it's A, B, and C. I'm not so sure, but I think it's A, B, and C that are reportable.
Okay.
I'm sorry, what was your question you asked me, Professor?
I asked you about common treatment approaches.
Okay. So of course, they'll have like medication that they could take for the treatments. Now these medications I can't pronounce.
Okay.
And let's see what else. See, I knew medication, and of course with the Hep B, with the sharing of the needles, you shouldn't share needles, so you try to prevent from sharing of the needles. And with, I think it was A, the one with the food and water. Of course, like she said earlier, they don't actually prepare it because you're actually still touching your food, so there's no treatment for that if you're touching. So if you have someone else doing it, it kind of will stop the spread of that.
Okay.
And of course, there's see, I think that was about all. I'm trying to.
No, that's
I mean,
great.
the only thing I would add would be like the vaccines.
My computer, I was trying to pull up the PowerPoint that we had.
Does anybody have any questions of the group? Anybody want to add to any of the areas that?
The only thing I would add is that there is a vaccine available for hepatitis A and B.
but not
So
safe.
vaccination is, yeah, vaccination is the best way to prevent it.
And when do
B.
those vaccinations start?
That I'm not sure about.
Very early on. When the kids are very young, right?
Oh, yes. That's what they get before they leave the hospital. Yeah.
Oh, yeah.
At least the first dose.
Yeah, because
Yeah.
my baby got one, like maybe a day or so later.
Okay. Great. Anybody else want to add any additional information? Okay, let's go to Bravo Group. Ashika, Merlene, and Antivia, and Kiera. You guys did HIV/AIDS. Tell us about it.
HIV is a virus that can cause AIDS, and it damages your immune system, which is weakening your immune system, which makes you more susceptible to bacteria and viruses and other diseases. HIV is left untreated, but you can control it, but there's no cure for it. You should also report it when you have HIV, because you can definitely give it to other people. It spreads through vaginal or anal, sharing needles, shooting drugs, piercing, tattoos, getting fluids on you, such as blood, semen, or vaginal fluids, or if you have open cuts or sores on your body. The symptoms are chills, fatigue, mouth sores, muscle aches, night sweats, rash, sore throat. Also, a little history behind HIV is that it came from chimpanzees called simian, and it was transferred to humans by that. And that's all I have.
Okay. See, Merlene, how do we control it? Kiera mentioned that it's not curable. We could try and control it. How do we try and control it?
I think I got the third part, but I think to control it, we need, there are some kind of medication can control it. And then we prevent, like she said, needles, stuff like that from well, people having some kind like of sex to protect. My part was the HIV surveillance reports.
The what?
The surveillance reports data. So you want me to read my part? The third one?
No, that's okay.
Okay.
Does anybody want to add to, and this could be anybody, how do we treat or manage the symptoms with HIV?
It says here that you should start in antiretrovirus reverse therapy, and the most effective treatment with a combination of more drugs that lower the amount of the blood in the body. This includes nucleosides, integrase inhibitors, protease inhibitors, and antigen inhibitors. This says that it helps keep your immune system strong, reduce your chance of getting an infection, reduce your chance of developing treatment, and reduce your chances of transmitting HIV to other people.
Great. Anybody want to
Also,
add to that? Go ahead, Emily.
Zidovudine and Retinovar, or I think that's how you say that. Those are two antiviral medications.
Great.
But you can get your levels super low to where you supposedly don't transmit it to others.
Great.
Which is pretty cool.
Yeah, thank you for that. Antiva, where are you? Question. Is it reportable?
Yes.
Okay, and so reportable to the local health department, CDC? Is this one of those reportable diseases or reportable conditions that come from hospital, doctor's offices, schools, pediatric offices?
Would it be the health department?
Yeah, yeah. So my question is this a reportable disease? Yes, it is,
Yes.
right?
Don't you have to contact
Yes.
people that you've had sex with in the past 6 months?
What about that group? What did you learn about that?
Yes,
I learned-
absolutely. Have to
Yeah, I
report it.
learned a lot.
Yeah.
You do.
And what else?
I learned honestly that there's a wide variety of new drugs that it will help like diminish the amount of the infection that you have in your body, so it doesn't so you can't transmit it to other people. But at the same time, you have to be really diligent with this treatments, because if you have a partner or if you want to have kids, it's something that you have to make sure that you keep under control. That way you don't pass it on to your kid or your partners, or any family members, like sharing stuff that you shouldn't be sharing.
Right. Excellent. Excellent. Anybody want to contribute or ask questions to the group?
I think it's only gonorrhea and chlamydia. You report the sex partners for like 60 days before, or do we do that too for HIV? Because like 60 days too, we need to report that.
Group, did you come across that information?
Because I hear somebody just mentioned that. I don't know who mentioned it.
I didn't hear the 60 days mentioned.
No.
No, not the group. I think it's someone was just say that. So
Hang on. The one thing about HIV, and this is on your study guide, that initially it can cause false negative or false positives, right? Or false negatives.
I will say that you have to keep it, like, if you suspect that you have been in contact with someone that has it, it's like your TB, and all of the diseases. You have to keep up, and I'm a phlebotomist, so if I get a needle stick, I'm supposed to be screened every 3 months for all of this stuff that can be transmitted, to make sure that I don't have the infection, because it's sometimes that you don't it doesn't show up as quick as if you had the flu or any other stuff that will show up quick in a test.
We know that sexually transmitted diseases, people with sexually transmitted diseases have a higher risk of HIV, right?
Mm-hmm.
What particular STDs? This is in your study guide. Chlamydia, syphilis, herpes, gonorrhea, right? Okay. Excellent. Thanks, guys. Thank you very much. Charlie Group did whooping cough. Is Malignus here? I don't see her. Trent's here, Pam's here, Farah's here, and Trinette is here. So tell us about whooping cough.
Okay, so we did pertussis. It's also known as whooping cough. So this is more than just a common cold. So it's highly contagious. It's a bacterial respiratory tract infection. The people most at risk are infants, pregnant women, and people with chronic illnesses. It can be spread by coughing, sneezing, kissing, handshakes, hugs, and touching. It is uncommon today, and it can be prevented by the vaccine DTaP. Let me see. So the first epidemic was in Paris in 1578, but it first appeared in France in 1414. And let me see. So it's described as a severe cough followed by a high-pitched whoop sound when you inhale, and it can last weeks to months. And I think that's all. I don't want to bore you guys.
No. Trent, do you have anything to add?
Particularly about the vaccinations. It does have a vaccine, which means it is a curable illness. First vaccine can be administered at 2 months of age, DTaP. Second vaccination is done around 4 months, and then third dose is given 15 to 18 month. Final booster is given 4 to 6 years of age. It kind of falls to the decisions of parents, though, and that can be a bit of a slippery slope, as we all know. But most of the time it'll be reported by doctors or whoever would be treating said patient. It is reportable to the CDC.
Farah, what do we do if families don't want to get vaccinated for pertussis?
You would just educate them. You don't really judge them. You would just let them know what the disease could cause. And you just let them know, like the benefits of it, and then just leave it as that. You can't really judge them.
Okay. And so where's Kira? There you are. So what kinds of things would you educate? No, I'm sorry, Trinetta. What kinds of things would you educate a family on if they didn't want to be vaccinated? What would be important for them to know?
I apologize. I do not feel good, and I have a really bad migraine, and I feel like I have to vomit. So
Okay.
if it's okay, can I please not talk?
You bet. Yeah, of course.
Okay, thank you.
So as we talked about in class, one of the most important things we can do with parents if they choose not to vaccinate, like Farah said, is educate them, right? Educating them that vaccines are the most important prevention from childhood diseases, right? So in the schools, when I was in the schools, the only thing I could do was come up with a plan B with the parents, right? If there's an outbreak of whooping cough pertussis in the school, here's the plan, right? You'll be the first to be called and encourage your kids to stay home until it's passed. Does that make sense, Farah?
Yes.
I mean, you got to come up with a plan for the parents of the unvaccinated, right? And the plan is not to be judgmental. It's to,
definitely.
Right? Okay, does anybody have anything to add with this group? Pertussis is nasty. It's a nasty condition.
It doesn't
Sometimes
sound great either.
Oh,
If you've ever heard it, yeah, you'll know.
yeah. Has
Oh,
anybody ever had a
that's
kid with pertussis or a family member with pertussis? Or you yourself with pertussis?
Patience.
Pardon me?
Patience.
Patience.
Between that and croup.
Yeah.
If I remember correctly, I was one. Not fun.
Yeah. It's a rough one, and the younger you are. So, okay, great. Delta group, did Ebola tie in? Is tie in here? Oh, there you are. Yes, you are. Gurley, Murata, Omar, and Shantae. Tell us about Ebola. Anybody? Omar, why don't you start?
Yes, ma'am. Go ahead.
Start us off.
Okay. Ebola. All right. Ebola is a rare, deadly disease that affects non-human primates and humans. It is a virus that causes severe inflammation and tissue damage throughout the body. Ebola virus enters a person through the mucosal membranes, breaks in the skin, of course, and oh, get a bad feedback here. Or parenterella, I guess. Parenterella. That's messed that word up entirely. So we'll keep it pushing here. So outbreaks mostly occur in African countries. Ebola virus was first reported in 1976 when 2 consecutive outbreaks, first in the DR, the Dominican Republic of Congo. And of course, let's see here, it's formerly known as the Ebola River, which gave the virus its name, of course, and the second South Sudan. The virus origin is unknown. In theory, they believe it is animal born. Most people say. Yeah. Everybody's skeptical. Okay, so with bats, non-human primates being the presumable source. There are 6 species of Ebola virus. 4 of 6 are known to cause disease in humans.
Great.
And it's a very ugly situation.
Yes, it is. Girly, what do you want to add to that? Treatments?
I can tell about the how it affects the body.
Sure.
So they attack major organs of the body, including the liver, spleen, adrenal glands, and lymph nodes. They also target specific cell types such as the endothelial cells that lines the blood vessels and the immune system. So by infiltrating the liver, it won't be able to do its job, and the body's ability to filter out the toxins from the blood is compromised. The infected endothelial cells cause blood to leak, resulting to hemorrhaging and internal bleeding. With the immune system affected, infected cells will travel all over the body and provides the Ebola virus the opportunity to increase its area of infection. So the initial symptoms of Ebola are fever, chills, weakness, muscle aches, and severe headache. And with no proper treatment, it will progress and the symptoms will become worse. So the person will then experience confusion. They're gonna have trouble breathing, nausea, diarrhea, stomach pain, and they can also bleed from the eyes, nose, mouth, and the rectum. And in the later stages, the virus will eventually, they will cause septic shock, coma, organ failure, seizure, inflammation of the brain, and eventually death.
Thanks. Tyan, are there any treatments? Or Tyan, do you want to share any additional information?
The incubation period is between 2 to 21 days, and they cannot transmit it unless they start showing symptoms, like the infected person.
Okay. Does anybody else want to share anything about Ebola? When did we have our scare here in the United States? Anybody remember? Omar, do you remember?
I was there, 2014, Georgia.
You were there.
I was a teenager.
Okay, so 2014. So
I was in
almost-
Puerto Rico and everyone was freaking out about it.
Okay.
Yeah, I had a guy seizing on my stretcher as I was going into Grady Hospital with him.
Wow.
And he had Ebola. We were all suited up the whole 9, you know.
Wow.
Yeah, it wasn't pretty.
Well, that's firsthand experience. Wow. Does anybody else want to add? Murata, you want to? Is there anything you want to add? Murata? I don't know if her Zoom's working.
Oh, I'm sorry, I was muted.
Oh, no, oh,
That
sorry, there you go. Go
it
ahead.
was I know that it's treated with medications, and they do a lot of oxygen therapy, like high blood pressure medicine. It was saying, I'm trying to go through the paper. I know, and they said a lot of comfort care too for them.
Right, right. Okay.
It's a medication called ZMAP, which is a what is it called? A experimental. So I mean, a whole bunch of other medication you're trying to push on the person's level in dealing with the Ebola. I mean, if they're dealing with ICP at the moment, are you going with mannitol? Are you going with a whole bunch of other medications to help this patient? So it's it's really depends of any contraindications to push it. You might need in their demand.
Totally. Well, great. Does anybody have any questions for this group? That's a lot of good information. How about our last group, influenza, our echo group? Michael, Emily, Raisha, Melody, and Melody. What do you want us to know about influenza?
Well, influenza is the flu, and if anybody has it, you'll definitely know it's the flu and not the common cold, because you'll have the sweats, the chills, the body ache, fatigue. Sometimes you'll have a fever, sometimes you won't. You'll probably have like a mild fever, and then it just goes away. And then the other symptoms come, like could be every hour a new symptom. It is highly contagious. It can be very dangerous into like the vulnerable population, which is children, the elderly, even pregnant women. There is a vaccine, and that's given every year, which is recommended. People with asthma is also vulnerable. It can be very deadly. Flu could turn into a pneumonia, and then you could be hospitalized, and then people die of the flu, which is the pneumonia. The main thing is you can prevent it by vaccine, washing your hands, staying away from people that has the flu, and just isolation if you do have the flu is another way of trying to prevent it if you have it.
Great.
Trying to think what else is important.
Let's let Emily pick up where you left off. Emily, follow Michael. What else do we need to know? Thanks, Michael.
You're welcome.
Okay, so from what I learned is with influenza, you can take something called an antiviral medication. One of the common ones I've seen is Tamiflu. And Tamiflu is usually only effective within 48 hours of your initial symptoms of the flu. So if you take it after that 48-hour time period, it's probably not going to be as effective. Although Tamiflu may help, it's not a cure. There's no cure for influenza. The best thing for you to do is rest and hydration. And if your symptoms get worse, seek more intense help. I'm trying to think of what else I learned.
Can I jump in real quick with the Tamiflu?
Yeah.
I took Tamiflu, and it was the worst. I was so sick. Oh, it was terrible. I wish I would have died.
One of my kids did the same thing, and they actually got worse with the Tamiflu. Yep. Raisha, how do we? Oh, go ahead, Emily. Sorry.
I just think that's a big misconception is Tamiflu is the cure for the flu.
Yeah. How do we diagnose true influenza versus a common cold, Raisha?
Sorry, I was on mute. It's usually diagnosed like with the viral cultural.
Exactly. Yep. Raisha, do you want to add anything to your peers?
Only thing I can add is like right now we're kind of actually in the flu season. The peaks of it is in January, and it ends usually around April or May.
Yep. And did we already talk about maybe Melody, you could address this. Who are our high-risk populations for flu? You're on mute, Melody. There you go.
Can you hear me now?
Yep.
The elderly.
Yep. And who else? Kids?
And the younger kids, yeah, because their immune system
Uh-huh.
isn't fully developed yet.
Right? And then certainly people with comorbidities and that may not be healthy. Maybe people that are going chemo, radiation, or any kind of immunotherapy. The
It
flu
also
is-
says when you're stressed out, you like your immune system goes down.
Exactly.
And you're like more susceptible to catch like colds, flus, like anything.
Right. Right. Yeah, influenza versus common cold can be extremely serious in vulnerable populations. Extremely serious. Anybody want to add any other information, statistics to influenza? Okay. Did you guys enjoy doing this project? Was it a good group activity? What were the, let's talk about group activity. What were the positives and negatives of doing this in a group? You'll first start with the positives. What were the positives of making this a group activity? Of completing this as a group activity?
We only had a certain section to do instead of the whole paper.
Okay.
You get to see other people's way of particularly putting information together and thinking.
Mhm. What else?
Also the good thing was it helped us to find like the communication, you know, even though that we all not in the same place, but it helped us to like communicate and get stuff done without being in the same spot to learn those type of strategies.
So you got to meet new students across campuses. What else?
I'd say it helps us understand the particular disease process, especially those ones that will end up being on our exam.
Good point. And these infectious diseases are also conditions, diseases you're going to be faced with in the communities, right? Maybe not Ebola, but hopefully. But your influenzas, your whooping cough, hepatitis, you're going to be working with clients with these, right? What were some areas for improvement you found in your group dynamics? Was communication an issue? Getting people to respond and do their part?
Not necessarily for me, but the only thing I'm not gonna, it's just a personal thing with me. I always feel like Canvas is clunky. I don't know what it is. I don't know. I'm like, I could text you so much faster.
Yeah. So since nobody has really any constructive feedback, let me just ask a question. Let's say you were in a group that people weren't communicating, people weren't doing their part. And let's say you're working as a case manager in a hospital, you need the help of coordinating a discharge and you need to coordinate PT or you need to coordinate home oxygen therapy, and those people are not responding. Does that make sense? What do you do? What happens if group dynamics are challenged? What are you going to do?
Move on and get it done the best way you can.
Okay, well, what if you're not the PT expert in the hospital, but you need, that's part of their services going home? I'm trying to put this in a real life situation, because the reason we do this group activity is because as nurses, we're going to be working in groups all the time, whether it's the group of nurses you work on with your shift, whether it's all the all the services your patients are being provided during the day, whether it's coordinating with a doctor or other healthcare providers to accomplish the plan of care for your patient. What do you do if you don't have good group dynamics? What you gonna do? Does anybody, go ahead.
It sounds like a committee meeting to me.
Does anybody have people they work with that are difficult to communicate with?
Yes.
Anybody?
I don't want to say anything.
Okay.
I will say
Well, I
nothing.
mean, I'm assuming the answer is probably yes. Let's say that person was part of a team that you had to come up with, I don't know, something.
I'm going to be honest, and I know this is, I shouldn't be like this, but I'm very much the type of person that, like, let's say I'm on the floor and one of my fellow nurses isn't doing a particular task. I'll just get frustrated and go do it myself. And I know that's bad. I
I'm
shouldn't
with
do
them.
that.
I'm with them. I just do it.
But I'm
I
just like,
agree,
oh my
Trent.
God, I'll do it. I could do it so much faster. Just go drink your coffee.
Is that the best way to handle it though?
I would
No.
find out who's
What,
capable
Omar?
of doing. I would find out who's capable of doing what and assign them those tasks most innovative to whomever, you know, is not going to do a hell of a lot. But in this particular matter, they've done their part. You don't want to exclude it. I mean, that can be a problem. But if you don't want to be held liable, but somewhere down the line, you're going to have a meeting with them, let them know, listen, you're going to have to step it up. That's it. You're going to have to step up to the plate because somewhere down the line, everybody else is pulling their weight and you're half-assing. We're not going to have that. So, you know, it winds up coming down to that. But for now, that's how it should be. If you ask me personally, that's how I would do it.
I mean, teamwork, group activity, teamwork, whatever you want to call it, in whatever environment you work in, is critical to the success of your outcomes, right? Getting through the shift during the day or night. So, you know, group activities, that's why I don't know if you've done group activities in other classes, but it's more, I mean, the content is important, but I like to talk at the end about group dynamics. How did it work? How did it not work? If it didn't work, what you learned from it and what can you take into your practice going forward?
Personally, I think that the biggest barrier was communication because not, you know, everyone has their own schedules. Everyone has their own classes that they take, and all of us were taking the classes at the same time. So, you know, if someone was sending a message, for example, at 3:00, maybe someone was in class, and you know, Canvas is not sometimes really resourceful because for me, my notifications of Canvas, they never show up.
Okay.
So you will have to be constantly checking to make sure that you haven't received an email or anything like that.
Well, yeah, time can be a factor. I mean, I'll be completely and utterly honest with y'all. I'm up at weird hours. Just any time that I'm awake, I'm awake. So, you know, you'll get a message from me at some time where you'll be like, "Are you healthy, Trent? What are you doing? Are you sleeping?" So I can understand how, especially with other people, don't, you know, some people like communicating a specific way too. When you know,
and we have to
go ahead.
understand that everybody has their different ways of communicating. You know, if you're working with 6, 7 people on the floor, everybody communicates differently, do they not? And so you have to be open and flexible to other people's way of communicating and try and incorporate that into your group work or teams work.
I tell a lot of my classmates, I'm like, look, if you got Messenger for Facebook or whatever, do that because it pops up and it gets my attention. The biggest thing about communicating with me, I can't speak for everybody, but with me, it's getting my attention. That's what's important because I'm all over the place.
Thanks for the input. Okay, you guys, that's it for me. Does anybody have any questions? Did you like the activity of going through it as a group? And hearing what others did? And I do this every term, but I always learn a lot about each of the, somebody always brings up something new. So. Okay, so you know, we covered all the housekeeping things at the beginning of class. Reach out to me if you need anything. I hope you guys have a good rest of the week. Okay. Good to see everybody today. Okay, see you later.
Thank you.
You're welcome.
Thank you.